that is food secure and health assured. On liberating our people from poverty, from the poverty of dignity, and making them health assured. A good example is the work that is being done by the Nairobi Metropolitan Service. Indeed, during one of my inspection visits to Mukuru Ruben, an informal settlement here in Nairobi, okay, I was saddened to learn that 500,000 people who live there were being served by one small private health facility which had only 8 maternity beds. A woman giving birth in this facility cannot be admitted for more than 2 hours. In fact, after giving birth, she has to get out in 1 or 2 hours in order to give way for other patients. The only time she can stay for a day is if she has complications and cannot be transferred immediately to any other facility. If this is not poverty of dignity, I don't know what it is. To resolve this, I instructed the Nairobi Metropolitan Service to build 24 Level 2 and Level 3 hospitals in all our informal settlements here in Nairobi. And I note with satisfaction that NMS is on course to deliver these facilities by the end of January 2021. The idea is to take health services as close to the people as possible. And with the completion of the 24 new hospitals, we will have increased the bed capacity in Nairobi's informal settlements by 280. But nationally, and as I said during my September 24, 2020 address to the nation, on COVID-19 we have done more. When we were afflicted by the COVID-19 pandemic in March this year, we had only 8 infectious disease ICU beds countrywide. 7 days after the first COVID case was discovered, we were able to increase this capacity to 60. And today, we have 827 infectious disease ICU beds, up from 8 in March this year. During my 12th address on coronavirus pandemic, we had 7,411 isolation beds nationally. And this was achieved in only 6 months. But 3 months later, in December of 2020, this number has tripled and now stands at 20,910 isolation beds. These achievements cannot be gainsaid, and we are very grateful for the support that we have received from our county governments across the country. In fact, in a very short period of time, we have installed medical equipment never seen in this country since independence. And by March of 2020, once the Kenyatta University Hospital Integrated Molecular Imaging Center is complete, there will no longer be need for any Kenyan to travel abroad in search of specialized cancer treatment. Our capacity will handle most medical conditions that are currently being treated abroad. Coupled with the expanded county healthcare infrastructure, we intend to use our new capacity to also promote medical tourism from neighboring countries and to roll out universal health care under the Big Four program. Although we have some challenges in the health sector, we must remember that our endeavors are a work in process. Building a robust healthcare infrastructure at the county level has to go hand in hand with protecting our health workers as well. And indeed,